I think what really makes this place different is how devoted we are to excellence. And it's not excellence for the sake of saying that you're the best. It's because by being the best, you deliver the best possible care to your patients. And that is what we're about.
The Department of Surgery at NYU Langone is really centered around excellent patient care. And the residency program is also centered around resident education. Residents rotate in these hospitals and those services and work hand by hand with world-renowned surgeons, leaders in the field, surgeons that are pushing the envelope in every disease process. And I think that gives them an experience that is unmatched anywhere else in any other residency program.
I think the training here at NYU is really unparalleled, whether it be the breadth of surgery, the different subspecialties, or the complexity of surgery.
I did my medical school here, I did my residency here, I did my fellowship here, and now I'm an attending here. So I really understand the system, the patient population. So it gives me a unique insight when it comes to helping to train our residents, having had all of that experience. I know what they're going through.
We are creating a residency program that gives our trainees the most well-rounded and complete experience while they're here with us, so that when they leave our program, they're capable and confident surgeons. Having the three campuses so close to each other, the NYU, Bellevue, and the VA, really gives us the opportunity to see a really wide variety of patients in three very different settings, all within a 10-block radius, which is something that you're not going to find anywhere else in the country.
So in Tisch Kimmel, you see the ultra-specialized, the people who are coming here because they have a disease that really requires a really highly specialized tool set.
Bellevue is a level 1 trauma center for everything essentially south from Central Park, which gives us a unique exposure to different sorts of traumas and very complex cases. And in addition to that, Bellevue is a safety net, one of the safety net hospitals, which gives us the opportunity to take care of the most vulnerable populations of our city.
The VA serves exclusively veterans. They are an amazing population of patients, so grateful, but also come with unique medical issues, social issues, mental health issues that I think you won't see in other hospitals.
The Surgical Innovation Program at NYU Langone Health is a program within the Department of Surgery that is dedicated to educating, mentoring, and overall exposing members of the surgical community, both from faculty all the way down to every level of trainee.
It's a program that allows residents to gain mentorship in an area of med tech, which is otherwise not necessarily as robust in surgical programs. And it allows them to really investigate that, whether it be during their clinical years, or they can take time off and do research in surgical innovation as research years.
We want our residents to be great doctors, great surgeons, but we also want them to be making the important contributions to the future of surgery. As part of their training, we offer them the opportunity to take several years during their residency to focus on research projects. And we have an amazing group of faculty members who will mentor them through that process.
I feel like our program is really flexible about accommodating what different residents' interests are. I have had incredible mentorship, incredible once-in-a-lifetime research opportunities. I was really fortunate that a lot of the xenotransplant research was happening when I went out on research. I'm interested in going into abdominal transplant.
Xenotransplantation is transplantation of an organ from another species, and it's one of many things we have pioneered here. I believe very strongly in discovery type of research and innovation. And in this particular field, we have made major contributions. And that then allows us to integrate our residents and our medical students into that work so that they really get, firsthand experience very early in their career of what it feels like to do something that nobody else has done before, to invent something new, to make a new discovery. For someone who's early in their career, it can be life-changing and career-changing and put them on a trajectory to make great contributions in the future.
We strive tirelessly to be the most innovative educational and academic health system in the country. We are willing to take risks, not when it comes to patient safety, obviously, but when it comes to innovating and trying to find the next way to be the very best providers of patient care.
There are a lot of educational resources that the residents get here that they don't get elsewhere. Specifically, NYSEM, which is a learning space that offers simulation-based education that fosters quality care, patient safety, and effective communication with patients and among healthcare professionals. There's also the Department of Surgery's Surgical Skills Lab that is available for independent practice 24/7 to the residents, but they also go there in dedicated skills lab session at least once a week where they practice their skills before they have to go to the operating room. Something that we take very seriously in our program is the protected education time, and that's a block of time that happens every week where the residents are completely protected from any clinical duties, and they spend their time either in the skills lab or in the classroom with the lectures that are given by our faculty. And this is a great time where the residents will process that learning and apply those clinical skills that they learn in the operating room and on the surgical wards.
NYU is actually one of the leaders in the country in robotic surgery. We do some of the most complex and the most robotic surgery in the country. And I think that gives the residents a really great exposure. I also think it's important. We have a great relationship with Intuitive, which is the robotics company, and we have dual consoles on all of our systems, which allow the residents to really be on the console, engaged in the operation.
We also have the CutSuit program, which is an open surgical skills curriculum for major trauma. It uses an advanced modular operative simulator, and it allows the residents to practice treating high acuity injuries, which don't occur that often. The CutSuit Trainer is a state-of-the-art simulator that allows the residents to perform anything from an ED thoracotomy, complete with repair of cardiac injuries and cross-clamping of the aorta, to a laparotomy with repair of major liver bleeding, splenectomy, shunting of major vessels, and without risking the life of a real patient. The NYU Surgery Residency program was part of the first ever pilot program using the simulator to train non-military surgeons, and is the only residency program in the world to use it more than 10 times per year.
CutSuit has really helped with operative readiness for our residents because it allows us to train doing high acuity trauma. And by doing so, when we go through the motions in an actual trauma scenario with a live patient, we feel a lot more comfortable.
Our global surgery program is meant to train the next generation of surgeons who are interested in pursuing a career in global surgery. We really want people who will begin to develop the cultural humility, the educational understanding, and the knowledge of the myriad of factors and disciplines that go into providing surgical care in typically underserved areas and finding ways to work with local stakeholders, populations, academic centers to improve access through care, through education, and through research.
NYU Langone general surgery residents may apply for the 4+3 pathway, which is a joint general surgery and thoracic surgery program. And during this fast-track pathway, residents complete 4 years of general surgery and then 3 years of thoracic surgery for a combined of 7 years of training. Residents apply in their second or third year of training, and during their fourth and fifth resident year, they dedicate a total of 12 months to thoracic surgery training. And then after their fifth year, they complete an additional 2 years of thoracic surgery and are able to become board certified in both specialty at the end of their training.
I was really surprised by how quickly everyone in this program gelled together. I didn't feel like there was this impression that, we were the new interns and no one was gonna talk to us. Immediately, we were accepted into the group. People were already, exchanging phone numbers, trying to welcome us to be a part of things, inviting us to events. And I do feel like the program leadership really kind of supports that. They plan things for us to hang out outside of the hospital and have that downtime, get to know each other on a personal level. And I think that's really, you can't beat that.
We're really fortunate to have very open-minded, receptive faculty. They're very accessible, they're open to our feedback. I feel like we're very much a partnership in trying to form what the program looks like.
The network available to NYU residents is one of the greatest in the world, I think. We have faculty who are world-class leaders in all different types of fields, cardiothoracic surgery, colorectal surgery, vascular surgery, you name it. We've got people who are leading the field in it. And it's great to just scrub cases with them, do research with them, have them so accessible to you, and it really sets you up for future success.
Our graduates get their top picks in their fellowship programs and in their career choices because they're NYU trained.
I have always dreamed of becoming a surgeon, and I could not imagine a better place to do so than at NYU.
One of the great things about being in a place like New York City is that you have the entire world at your fingertips when you're not here in the hospital. We work really long hours, we work really hard, but there are all these opportunities to go and see a play, to eat in an incredible restaurant, to see your friends who are outside of medicine and who help keep you grounded. And I think that's something really unique about training here in the city.
Coming from out of town to New York, it was a little daunting at first and a little intimidating, but NYU actually has a lot of great resources.
The public transportation in New York is kind of second to none. I can get anywhere with just, a swipe of a MetroCard.
New York is the best city in the world, and I think from a professional perspective, New York City is a unique place to train because it has the most diverse population on earth.
This is not just a place where you're gonna see bread and butter general surgery and see everything that's, kind of stayed the course in the surgical arts, how surgery's always been done and the things that we haven't changed, but you're also gonna see the things that are changing right now. And you're gonna see it as a resident in the operating room. You're gonna see all this cutting edge technology and be able to watch it be put into use and hear from these groundbreaking surgeons as to why they decided to take these routes, why they decided to investigate this stuff further. And as a resident, to see that and to be a part of it, it's really second to none. And I feel like no other program is really gonna train you to be a better academic surgeon than this place.